Hello everyone. It's my pleasure to get introduced to you with the most demanding topic, COVID-19. Here we have a presentation on Autoimpilo, a smart automated health machine using IoT to improve telemedicine and telehealth. I am Divya and I am glad to represent our dynamic team which is guided by academic mentors Dr. S. Sumati ma'am and Ms. Panchavarnam Bose ma'am of EC department from Sri Sairam Engineering COllege and our industrial guide Dr. Mikli Satyanarayanan sir from MIT Square, India. These are a quick overview of the contents that I am going to take you through this entire presentation. The deadliest disease of the 21st century, COVID-19, otherwise called as novel coronavirus, has spread its arm throughout the world, taking lives of more than 1.7 million people, and it's increasing each day. Coming to the exact problem statement, the novel COVID-19 has created an indelible fear in people's mind. Also, in developing countries like India, the lack of basic medical facilities and primary health care throttles its reach to 60% of the people in India. To the worst extent, the rural people even find difficulty in accessing their healthcare services due to the geographical barriers. To change the situation, our automated system, Auto Impilo, aims at connecting doctors, hospitals, patients in real time. Timely diagnosis can lead to faster recovery. That's right. Enabling people to access medical facilities at their need can control the spread of the disease and reduce the mortality rate to a greater extent. Our system ensures free of cost services 24/7 and provide facilities to video consultations with physicians without the physical presence. It can also dispense medicines based upon the doctor's diagnosis and help patients track their medical records. The term autoimpilo has its origin from Zulu language. Auto means automated system and impilo means health. Thus, projecting an automated system to take care of our health. The system is an initiative towards Sustainable Development Goal 3, Good Health and Well-being, and National Health Protection Scheme of India. This system also stands aside to promote telemedicine and digital health, ensuring medical facilities reaching each nook and corner of the world. The automated system is aligned with India's universal healthcare policy called National Digital Health Mission (NHDM), which is a complete digital health setup which can be accessed with the help of smart health IDs. These health ID contains patient's history and can be securely accessed using PIN numbers. The system focuses on having services like general health checkup, which includes screening for general illness and dispensing medicines based upon the doctor diagnosis, a specialized COVID screening, and an emergency care to avail ambulance services. The product features includes user-friendly and interactive GUI, availing and tracking of emergency ambulance services, medical dispensing, online video consultation, general and COVID screening, and provision for e-prescription for future usage. And reference. The additional features includes scheduling appointments with physicians and provide multilinguistic supports to help people access AHM without hesitation. This multilinguistic support can help rural area people to access the facility with ease. It is a power efficient design to provide services 24/7 and secure payment services and data transfer. It helps people by providing information of hospitals in vicinity and referral and trade stations. It also has facilities to link with NGOs, insurance companies, and organ donation network to help people access all the healthcare related facilities at a single place. The AHM is designed after the background study of various health missions like autospins and health kiosks, which are meant to dispense medicines and provide healthcare services respectively. They are standalone missions in which autospins can manage inventory and securely dispense medicines, whereas health kiosks can provide emergency services but fails to track them. The system is built using Arduino and Raspberry Pi controller. It uses Internet of Things to store the patient's parameters, which is taken through sensors. And these patient records are securely stored in the cloud databases, which can be tracked through patients' mobile devices. A touchscreen display provides easy user experiences, and camera provides facilities for video calling with professionals. The AHM ensures sanitation before its usage in accordance with its new normal, and this can be achieved with the help of the UVC lights. The general flow diagram for COVID screening involves detecting the person using IR sensor. Once the person is detected, the UVC lights are triggered to sanitize the hands before availing the AHM services. The smart health card and PIN number can be entered to avail or access the healthcare services, and the chatbot gets initialized. The chatbot is meant to get symptoms from the patients, and these temperature sensors are triggered simultaneously. If the temperature is greater than 100 or higher than the threshold value, the online video call with the doctor will be initialized. In case of serious illness, it automatically books appointments for swab tests at nearby hospitals and call the ambulance services. If it's not of serious illness, then the doctor can prescribe medicines, and these medicines can be dispensed to the patients via servo motors in the AHM. In case, after the swab test, if it is tested positive, then the patient's family members can track the health of the COVID patients during hospitalization using a dedicated link, as patients' conditions will be unknown until the patient inform their family members. The AHM is designed in such a way to avail all the facilities which have been mentioned, and this is the 3D model of the desired AHMs that can be installed at every places to avail medical services. In general, the screening the system is capable of checking the primary healthcare services like heart rate, temperature, blood pressure, and oxygen saturation, which are the critical parameters to confirm the COVID 19 infection. We conducted pilot evaluation with patients, nurses, and doctors. As an overall outcome, the practitioners feel that the system can be adopted in an area where medical facilities is not available immediately. Adopting the system in such regions not only help in medical emergencies but also increases the percentage of survival. Installing AHMs in rural areas can be greatly reduce the travel time and the expenses of the people. In emergency cases, faster the initiation of medicines can increase the percentage of survival. The health ID securely maintains the patient's records, and the privacy is maintained by installing AHM inside a private setup or a room as shown in the figure. It can be deployed in health centers and public places such as train, bus stations, schools, airports, and markets, and even in commercial areas like malls, accident zones, locality, and in other places that can be quite useful and helpful to public. The AHM can be further enhanced by tracking patients who have availed AHM services and provide data to the management. The AHM can also be enhanced its performance by using training technologies like artificial intelligence, machine learning, and deep learning, and have a better accuracy in predicting diseases. The AHM also can be further enhanced by booking appointments with specialists, thereby creating a network of healthcare professionals and patients all over the world, and providing services like gesture recognitions and guidance for physiotherapy care and many more. So, installing this multipurpose AHM can certainly save lives of many people in rural areas by helping them to access medical facilities at their place. So, let's fight and win the COVID successfully in the coming year 2021. And until then, let's stay safe and thank you.